So with the one visit crown, the OVC, I found it particularly useful in my clinical setting in terms of my practice with patients that need a crown, need something that requires a large restoration, but they're unable to afford a conventional crown. So the OVC is a great treatment alternative for them to basically choose from and get a great clinical result from. So recently I did a case where there was a lower molar that had a cracked tooth syndrome. So the patient was exhibiting a bit of pain when she bit down on something quite hard or chewy. So we had a discussion about her options, so whether or not she placed a crown, a large composite restoration filling, or I also offered her to do a one visit crown at the same time. After discussions of the costs, the advantages and the disadvantages, she did decide to go ahead with the one visit crown. And we successfully did that, and she's been symptom-free ever since. Typically after a treatment with the one visit crown, the first reaction I get from a patient is, oh wow, was that all, it only took 40 minutes to do. I didn't know I could get a crown done on the same day. And it's pretty surprising to them that they're so used to getting a crown done, with 2 appointments in 2 or 3 weeks, to then be able to get a procedure done within 40 to 50 minutes and walk out of the clinic with a crown. They're usually pretty ecstatic. So the one visit crown is something that I don't see will ever honestly replace a traditional crown, nor will it ever supersede a large composite restoration. It's always been just there as a third treatment option to my patients that bridges the gap in between a large composite filling and a traditional porcelain crown. So I'm still going to keep offering traditional porcelain crowns to my patients, but the one visit crown is just an additional treatment modality that I can happily offer my patients to get great clinical outcomes. So the differentiation between the OVC to me as well as the crown is that a traditional crown is something that I custom make through a lab over 2 weeks. So it's a bit of custom designed jewellery just specifically for their tooth. It's something that just goes right in, it fits in exactly with their mouth, and it fits in just like any bit of custom jewellery would. An OVC, so a one visit crown on the other hand, it's something that I've got on the shelf. It's still a crown, it's still something that gives a really good positive clinical outcome. However, I need to select the sizes, I need to select the shape, I need to select the tooth, and then select the right tool for their tooth. Once I do that, I basically can then shape it to modify the actual one visit crown to fit their tooth and make it fit according to their tooth. So it relies more on me as a clinician to give a good clinical outcome as opposed to a lab seeing my mould of their tooth and then working with that. I love the one visit crown. I think the OVC is a great product. It's very easy to use, very economical, and my patients seem to love it.